So looking at veins, this schematic kind of compares arteries to veins, and we'll point out some of the important differences. So first of all, we can see a larger lumen, meaning that veins can accommodate a much larger volume than arteries can. We also see a smaller layer of smooth muscle, right? There is smooth muscle, and we'll talk about why that smooth muscle is important in veins, but it's a much thinner layer than we saw in arteries. There's also a thicker wall, right, in arteries than what we saw in veins. And there's also the presence of valves in our veins. What do you think valves do? What would be the importance of valves? Preventing backflow, excellent. So veins have a very unique challenge. They're working, not only are they high volume, but they're working against gravity. And so valves are really important to keep blood moving to the heart and prevent blood from flowing backwards. So let's start by looking at the venules. They're much smaller than arterioles. They connect capillary beds to veins. They have a small layer of smooth muscle. They don't have a lot of those other layers that we talked about. And so what we can see here is that there is some minimal exchange still happening at the level of the venule, kind of like the exchange that we saw at capillaries. Because they're so tiny and they have a very thin wall, there is some minimal exchange happening here at venules. Okay, so what we can see here, not a whole lot of smooth muscle, very tiny wall in terms of the barrier for diffusion, and that facilitates some movement of materials. And this is all that we'll say about venules. They aren't very fancy. This is the extent of our discussion with venules. Veins. Veins have a larger diameter, again, a thinner wall. They have valves which keep blood moving in one direction. Now the valves are not present in all of our veins, only in the peripheral veins. So think about veins in your limbs, veins in upper limbs and lower limbs, but central veins, which are our cerebral veins of the head and veins of the core, veins in our thorax, do not have valves. They have other mechanisms to keep blood flowing in one direction. So we do have valves, but only in peripheral veins, which really have to work against gravity. Think about where the lower limbs are, think about where the upper limbs are, etc. And just to recap here, we see a thin wall. We do have smooth muscle. We're going to talk about the importance of that smooth muscle. I keep saying that, but a larger lumen and a wider diameter in terms of the amount of volume that they can hold. Okay, so veins are a volume reservoir, meaning that they are compliant vessels. Who wants to kind of summarize what compliant means? What do we mean when we say compliant?
They like expand, they like assume their shape afterwards.
No. So what are we describing when we say that they reassume their shape? That's something else. That's elasticity, right? So quite the opposite. So compliance means that they're kind of really obedient. As far as you will stretch them is as far as they will go, okay? And so veins do that. They can accommodate a large amount of volume without generating much pressure, the way that arteries do. So they expand, accommodate large amounts of volume without exerting much of a change in pressure. And so this is where they function as a blood reservoir. They basically hold a large chunk of our blood volume. Most of our blood is pretty much just sitting around in our veins. So 60% of total blood volume is sitting in veins at rest, and that's because of their high compliance. So this graph compares compliance of arteries and compliance of veins. And what we see is that veins can accommodate a large change in volume without very much change in pressure. And arteries cannot accommodate much volume, right? They're much less compliant. And so they generate a lot of pressure for the slightest change in volume, okay? So this is comparing the compliance of arteries and veins. And you can compare this to those stretchy sweatpants that I was talking about. So arteries are like a brand new pair of sweatpants, right? You're gonna put them on, they're gonna exert more pressure, accommodate less volume, whereas veins are like a really old, worn out pair of sweatpants. They're gonna be able to stretch really well, accommodate more volume without giving more pressure. So this pie chart shows where most of our blood volume sits at rest. Most of it is in veins and venules, 60%. The other percentage, which is much smaller, is in the heart, 8%, the capillaries, 5%. We've got 12% in the pulmonary circulation and 15% in systemic arteries and arterioles. So even if you combined all of the blood that was not in our veins, it's still only half the volume of blood that is existing in the veins, right? So most of our blood is just pooling in our veins. Now, this can be quite detrimental. So think about the fact that veins can accommodate such a high volume. That's nice, but it's not going to be efficient in terms of the vasculature system on a whole. So there are some factors that really help the veins with their venous return, help to get blood moving back to the heart. The first one is the skeletal muscle pump. And this is basically the skeletal muscles of our peripheral limbs working in concert to increase blood flow back to the heart and prevent backwards flow of blood. So basically when your muscles contract, think about the gastrocnemius muscle, your biceps and triceps, they're encircling a lot of the big veins, right, of our limbs. And when your muscle contracts, you squeeze blood from the vein, the blood that's in the vein, towards the heart, usually against gravity, and that keeps blood from flowing backwards to the distal part of that vein. Whereas when the muscle relaxes, you can bring in fresh blood and you can prevent the blood that you just squeezed out from coming back into that area. So this image kind of illustrates that very nicely. So think about the gastrocnemius and soleus muscles. They squeeze and compress the vein. That flows blood towards the heart through a proximal valve, whereas that distal valve is closed. That's preventing backflow. And then when the muscle relaxes, we have a valve that's proximally located closing. That is really important in preventing the blood that we just squeezed out from coming back into that central area. Okay, so really important that these muscles work in concert, contracting and relaxing to keep blood flowing towards the heart. So that was the first mechanism of increasing venous return. The second one is the respiratory pump. So the respiratory pump works in a very similar way as the skeletal muscle pump. It's basically creating pressure gradients across the thorax and the abdomen, which again squeezes blood towards the heart and prevents backflow. So when we inspire, our lungs fill with air, our diaphragm comes down, right? It's dragged down, and it actually increases the pressure that's in the abdomen, simultaneously decreasing the pressure that's in the thorax. What does that create? A pressure gradient, excellent. So we have a pressure gradient, which we know is the key driving force for moving fluid, for moving blood. So we have a higher pressure in the abdomen, a lower pressure in the thorax, and that drives blood from abdomen up into the thoracic cavity. And this is really important in increasing venous return, okay? I'm gonna keep using that term, venous return. It's a term we talked about last semester, and it's basically how much blood is going back into the right heart, how much blood is going back into the atria, okay? And if we increase venous return, we'll see later on, that's a really important part of circulation. The heart cannot pump out what has not entered. The heart cannot pump out what it's not filling. The third factor is blood volume. This is much more of a long-term regulatory factor. Basically, increasing our blood volume increases venous return, and that makes sense. More volume exerts a higher pressure to move along towards the heart. Whereas if we decrease blood volume, we will decrease venous pressure, okay? But this is a long-term response because this happens at the level of the kidneys or the level of the thirst center. So if you have low blood volume, it's gonna take days to weeks for your kidneys to adjust their water balance or for your thirst centers in the brain to adjust and you can bring in more fluid and adjust those blood volumes. So it's not a short-term response, but it is a mechanism that will increase venous return. The venomotor tone, so this is where that smooth muscle tension comes in. Where have we heard tone before? The arterial tone, excellent. So it's that smooth muscle that has that partially constricted state, even in the absence of external factors. And veins have that very same kind of architecture. So basically, the venomotor tone is where the smooth muscle, that small strip of smooth muscle in the wall of veins can constrict on itself, and that can create some pressure, some force that can move blood along and prevent backflow as well. This is also influenced by the sympathetic nervous system. So very much like what we saw with the arterial radius size, the sympathetic nervous system, via the presence of alpha adrenergic receptors that are present on the vein smooth muscle, binds norepinephrine, and that elicits that constriction of that smooth muscle, which helps with that tone and helps to move blood along. This increases central venous pressure. This decreases the venous compliance. What does that mean? What does that mean, decreases the venous compliance? Yep, so the veins behave in a little bit more of an elastic fashion. They're going to start to give some pressure onto the blood that's in that vessel, okay? They're not going to be as lazy, so to speak. Okay, so decreasing the compliance, not totally, but partially, is really important in getting that blood moving back to the heart. Again, increasing venous return. All right, so let's look at all these factors here in this flow chart. So the first factor, the one that's influenced by the sympathetic nervous system, is the venomotor tone. Increase of sympathetic activity increases the binding of norepinephrine to those alpha adrenergic receptors, increases the constriction of our venomotor tone, or our smooth muscle inside the veins, and that increases venous return or decreases venous compliance, okay? The other factors were blood volume. So we said this was a much more long-term response, but it also increased venous pressure. So if we increase the blood volume by either limiting our output in the kidneys or increasing our thirst center responses, we would increase venous pressure. We could increase the skeletal muscle pump, that would increase return, as well as increasing the respiratory pump via those pressure gradients across the thorax and abdomen. So all of these factors increases venous pressure, which increases venous return. So this is kind of where this becomes important in the overall function of the vasculature. Increasing venous return is vital to increasing atrial pressure, right? The amount of pressure that fills into the atria of the heart, that increases end diastolic pressure, and that's the pressure that's exerted because of that fluid that was filled. Increases end diastolic volume, again, the total amount of blood that the atria filled at the end of diastole. Sorry, the ventricles filled. All right, so follow me here with this chain of events. If I bring more blood back to the atria, I'm going to send more blood down to the ventricle. I'm going to pump more blood out, right? It's only a chain of events. We cannot vascularize tissue if blood is not coming back to the heart. And because the veins are really nice at pooling blood, it's really important to get them to send that blood back to the heart in order to maintain oxygenation of tissues. Okay, so we increase our atrial pressure, end diastolic volume. This increases stroke volume, okay, the amount of blood that then leaves the heart, that's pumped out. And that increases cardiac output, which we know influences what? Mean arterial pressure, exactly, okay? If we have zero cardiac output, we have zero mean arterial pressure. So this is just one big cycle, and the veins can be kind of lazy. They can kind of hog all the blood, and that's not good. We really need to get that blood moving back to the heart so we can get it out of our ventricles and circulating to our peripheral tissues.